Good afternoon, everybody, and welcome to the Massey Dialogues. My name is Krish Bilimoria, and I'm a first-year resident junior fellow here at Massey College and a second-year medical student at the University of Toronto. Massey College is a place for ideas. It is a place that has a mission to nourish learning and serve the public good. Massey, its fiscal location, is built on Indigenous land, the land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. We are grateful for the ability that we have to continue our work here, particularly in these difficult times. The Massey Dialogues are based on the idea that to serve the public good, we need to build bridges between cultures, between disciplines, and between generations. This is what the Massey Dialogues will try to achieve. We will hear from great researchers and their work and practice to dialogue across divides, intergenerational, interdisciplinary, and at times intercultural. This is our first week, and for me, who is stepping in for Principal Nathalie Desrosiers, is also my first time hosting, so please I ask for your patience. We're trying this format and welcome any feedback on this initiative. Now, before launching into our dialogue on the work of Principal Emeritus Hugh Segal, I want to invite the audience to consult our website for the calendar, which will advertise our dialogues for the next week. On Tuesday, April 7th, 4 p.m., Principal Nathalie Desrosiers will be in conversation with Lorna Goodison, Jamaica's Poet Laureate, and a recent awardee of the Queen's Gold Medal for Poetry, so stay tuned. Our format for today is the following. I'll introduce our guest, Principal Emeritus Hugh Segal, and speak with him for a few minutes, and then bring in the perspective of Senior Fellow Dr. Danielle Martin and Senior Fellow Dr. Peter G. Martin to react to what they've just heard and describe what they find inspiring, disconcerting, and intriguing. I also want to encourage those listening online to ask questions during the last part of our time together. You can leave comments and questions directly on our YouTube chat at the right side of your screen. Today it is my pleasure to introduce Principal Emeritus Hugh Segal. The Honourable Hugh Segal is a Canadian political strategist, author, commentator, academic, and former senator. He served as Chief of Staff to Ontario Premier Bill Davis and later to Canadian Prime Minister Brian Mulroney. Segal was a senator from 2005 to 2014, after which he became Principal of Massey College. He's the author of many books, his latest being Bootstrap Needs Boots, One Tory's Lonely Fight to End Poverty in Canada, which he launched at Massey last spring. He's received many honors, among them the Order of Canada. Welcome to the Massey Dialogues, Principal Segal.
Great to be here, Krish, as always.
Great. So let's just get started. What is basic income and what drew you to the idea?
Well, basic income is the principle that rather than have a rules-based, bureaucratically driven application process whereby people have to prove they are really poor before the bureaucracy approves them for welfare, which only, by the way, gives them about 45% of what the poverty line requires in any Canadian province, it would be an automatic top-up that people would receive when their income collapsed for whatever reason, whether it was unemployment, whether it was because of some physical disability, whether it because of some inherited difficulties or health issues. It would be automatic, it would be run through the tax system, it would be efficient, and it would be managed in a way that did not produce a sense that the poor are clients of the swells who are in government, but rather we are all citizens, and everybody has the right to a basic amount with which they can negotiate life, something which I think we are seeing in our present circumstance very clearly. Right.
And so you were the artisan of that discussion paper, Finding a Better Way, a pilot for basic income in Ontario. This pilot sort of described a way to test basic income. Why does basic income need to be tested?
Well, it's probably appropriate that it should not be easy to make changes in a democracy where there are different points of view about how best to do things. We have really done welfare one way in Canada since the poor laws of the 19th century. And it's always been based essentially on people applying, meeting a set of criteria. And I think the criteria for Ontario, for a recipient of Ontario Works, is something like 600 pages full of rules and regulations. The notion that we are going to make a change or see if there's a better way should, of course, be evidence-based. And therefore, the premise that Premier Wynne brought to the table was that let's do a trial run to see how a basic income would operate. And 3 separate communities were chosen: the Hamilton-Brantford area, the Thunder Bay area, and the Lindsay area, all of which had different attributes in terms of community, mix of people, nature of the local economy, etc. And we could then assess whether the impact of basic income on the recipients and on the community was measurably different and or better than how welfare was operating. So there would have been in that proposition a control group, people who had not changed the way they were getting financial support, living beneath the poverty line, and this other group who would have been registered as part of the basic income pilot. And then you could compare the numbers and the results for each group. And you could also, in the Lindsay case, look at what happened to the community in terms of educational outcomes, healthcare outcomes, strength of community involvement, issues which we have to look at if we're going to really measure the impact of the basic income as a step ahead.
Okay, and so you proposed that really interesting pilot, and what happened? Did it complete to its fulfillment, or did it end early?
No, the pilot was supposed to run for 3 years, and it was canceled by the government of Ontario, which had changed in an election in 2018 after 1 year. So there was never the detailed data collection that would have made the pilot and its results something we could use constructively. But fortunately, our academic colleagues at McMaster University in the Department of Economics did do a detailed study of a large cohort of recipients in the Hamilton-Brantford area. And their results bore out what we found in a previous test, which was done by a visiting scholar once at Massey, but then and now a senior professor of health economics at the Manitoba Health Science Centre. She did an assessment on a test that was done in 1975 in Dauphin, and it produced significant results and very encouraging results about people still going to work even though they were eligible for the top-up, about less use of the Manitoba health insurance program because people were better off physically and mentally and emotionally by virtue of getting that automatic top-up, and a host of other positive results, which becomes part of the data set that we have. And now we have a similar modest data set from Hamilton because of the work of our colleagues. I think it was Professor Luchuk of the Department of Economics at McMaster.
That's wonderful to hear. And going back, I guess, to your points on prior data sets, the current discussion on basic income has both opponents on the left and right. The right worries about laziness, about the lack of incentive to work, and that the left worries that future governments could just decrease the basic income so much that it wouldn't help people. How would you respond to these critics?
With respect to the concerns expressed on the far right, I would say that, I'm a great believer in the Protestant work ethic, and I don't think it's intrinsically a bad thing, but there is no data, no evidence in any of these pilot projects that have been done that people work less because they are eligible for the top-up. Quite the contrary. And in fact, in our own community here in Ontario and across Canada, 70% of the people because one job is not enough, depending on the level of wages, to get above the poverty line in the Canadian community in which you happen to be living. And to my friends on the left, I would say, not if you do it by statute. Things like the Ontario Health Insurance Program, for example, and a host of other benefit programs are established by law. The Guaranteed Income Supplement for seniors above 65 is established by law. And you have to go to Parliament to get those rates, if you wish, changed. So nothing is forever or carved in stone, but the notion that it could just be wound down because some Minister of Community Services decided to do that is basically without any justification.
Okay, and if you were to see a basic income pilot renewed in Ontario, would you choose different locations or continue the work done in your previous sites?
I would say if we are going to do another pilot, and this is the proposition that's now under consideration in Prince Edward Island, where they have an all-party committee, the Tories who form a red Tory government, the Green Party, who are the official opposition, and the Liberals, and they're thinking very hard about a province-wide proposition where you could do a pilot right across Prince Edward Island. There's about 22,000 islanders who live beneath the poverty line. So that's a manageable number in terms of comparing that to traditional welfare relative to outcomes and results. And I would think that if we ever get a government that wants to do another pilot, or more importantly, if we get a national government that, learning from the experience we're all going through now, decides it wants to facilitate a national test, that would be the best way to go forward. I think having evidence before you proceed makes perfectly good sense. And certainly the last pilot in Ontario was structured so that the evidence could have gone one way or the other. It wasn't preloaded in any way. But I think we are learning now, in our present circumstance, that existing programs, setting aside the best intentions of public servants and governments of any political affiliation, we lack the agility and the capacity to move money quickly to people who wake up one morning and find that they are income free because of decisions that have been made in the interest of public health, as the case may be. And we don't have any difficulty for the governor of the Bank of Canada to provide greater liquidity for the banks. We don't have any difficulty in changing the ratio of leverage so the banks can have more money to lend, all of which is good. I'm not opposed to any of that. But the notion that we have liquidity for the large institutions and can't find a way to provide liquidity on a timely basis to individuals who find themselves with zero income through no fault of their own strikes me as fundamentally unjust, and it reflects badly on our capacity as a society to get things done as a democratic community that's trying to be fair to everybody.
And I think you've mentioned a number of interesting points on nimbleness and moving quickly in the face of an immediate sort of threat. And I guess the situation that we find ourselves in with the coronavirus pandemic is one situation that requires swift action. I've just been speaking to a number of clinical supervisors who are saying that their hospital keeps encouraging to act and move nimbly, but it's incredibly difficult to identify how to do that. Could you speak more about what basic income might do and whether that approach is more nimble or not compared to existing forms of government support?
Sure. So in order to be eligible to receive welfare or employment insurance or any of those income security programs or work insurance programs, you have to apply. Mm-hmm. And that application has to be processed against a series of criteria and rules. And public servants and or a mix of public servants and algorithms have to determine whether you meet the test for eligibility. That takes time. If you think about people who are registered for the GST tax credit, and I remember, Krish, when I taught at the Graduate School of Queen's, the School of Policy Studies, where I'm delighted to now be affiliated, I would always say to my graduate students in early April, I hope you file your taxes. And they'd look at me and say, Professor, we don't have any money. Mm-hmm. No one's sending us any money. I said, that's precisely why you should file your taxes. Yeah. Because if you do, the GST tax credit, which was distributed to people earning $30,000 a year or not, and that or less rather, and that was brought in with the GST, which was brought in so that people would not be paying too much of their income as a percentage of their income into the GST, would make automatic deposits into your bank account. And that's what CRA has done, and I think they have the capacity to do it for only 28 million Canadians, not all, but only 28. Can you imagine? And so that system exists, and it's instant, and it doesn't require application. It doesn't require an endless bureaucratic analytical process. And to be fair to our public servants, God knows they're not without other crushing and important things to do. It's not about being lazy. It's just about the volume of work. But an automatic top-up would work much more efficiently, and we could have already put money into people's bank accounts. I think of, as I look out my window here in Kingston, I see some of the greatest restaurants in Canada, and everybody who worked there is out of work. Mm-hmm. And some of them may be eligible for EI, some of them may not. Some of them may be eligible for the wage subsidy, they may not. But if we had the other system in place, the top-up would be instantaneous. They would have liquidity and cash. And in the end, I don't think dealing with poverty should be about judging whether the poor merit our support. Any one of us could become poor overnight for one reason or another. The issue is, how much do you need to live properly, to be reasonably healthy, to have equality of opportunity, and how quickly can we get it to you without judging whether you're still poor or whether you're as poor as you said you were 2 weeks ago. And we're now seeing all kinds, for example, people in Ontario who have a physical or intellectual disability can receive the ODSP, the Ontario Disability Support Program. Many of those people have been told that if they accept the emergency transfer that Prime Minister Trudeau has promised, they will lose their ODSP payment.
Okay.
Right? And they're not getting the ODSP payment because they don't need the money. They need the money desperately. So those are the kinds of destructive choices which I don't think do much to build a sense of coherence and common opportunity.
That absolutely makes sense to me. And I've just been looking at some data published last week. That says about 44% of Canadian households have had someone that has lost work or have seen layoffs due to the COVID pandemic. What do you think about how the economic upheaval created by the pandemic might reintroduce the idea of a basic income in this time of need?
Well, my instinct is that when we get through the pandemic, please God, we will have a series of rational discussions as a society about what we did well and what we can learn from that and what we could do better in the future. And there'll be a whole bunch of interesting discussions on the medical side about the strategic reserve of supplies and other things that we need. There'll be a series of discussions about our relationship with other countries and travel and all that good stuff. Will have to be a discussion about how we manage the income collapse. If you think about the two core freedoms, freedom from fear and freedom from want, when they come together, when both fear and want come together, that's when you can produce some pretty difficult circumstances. And I think in that context, there will be an opportunity for the provinces and Ottawa to discuss together what can we do on the income side and the economic stability side that is more efficient, more effective, and more likely to be more constructive. And that's where I think we have a great opportunity to move to a basic income.
That's helpful to hear. And we just had a question in from our audience that perhaps you could speak more about. Kaleem Kassam says that he's confused about the top-up terminology. Does top-up means mean tested to guarantee a minimum income, or is it an additional amount universal regardless of income?
So a basic income, if it's done in the way that I have recommended over the years, which is through the tax system, would operate the same way as the guaranteed income supplement does for Canadians who live 65 years of age or older. If your income falls beneath a certain level, you're automatically eligible. Period. Full stop.
Got it.
And there's no need for a separate bureaucracy or a whole new department. We all have to file our taxes every year. That's the law. When you file your taxes, your income is declared openly, and that would be the trigger to make sure that you get what you should get to bring you up to a reasonable level for survival in your own community.
Great. Thank you so much for that, Hugh. Now I'm going to be introducing our voice of medicine here today. Our voice of medicine on Massey Dialogues today is Dr. Danielle Martin. Dr. Danielle Martin is on the front lines of transforming the healthcare system. An internationally recognized health policy leader and executive, Martin is committed to revolutionizing healthcare to meet the demands of the 21st century. She speaks with passion in our national healthcare system, defending and defining the ways we can make it even more worthy of our national pride. Currently, Martin is the Executive Vice President and Chief Medical Executive at Women's College Hospital, where she is also a practicing family physician. She's leading the creation of Women's Virtual, Canada's first virtual hospital, and helping to create a hospital that leverages digital tools to bring care directly to the patient, reshaping modern healthcare to be more accessible, timely, and innovative. Martin made headlines in 2014 when her testimony on the merits of the Canadian versus American healthcare systems at a U.S. Senate subcommittee hearing with Senators Richard Burr and Bernie Sanders went viral. The video received over 35 million views online, as well as worldwide media attention. Welcome, Danielle Martin.
Thank you. Hi, Krish.
Hey. Dr. Martin, or Danielle, is that okay if I call you Danielle? Great. Could you tell us a bit about how securing a basic income can promote health, both individually and at the community level?
Well, I think it will not be a surprise to any of the folks who've logged in today to know that as much as we're all very focused right now on healthcare, hospitals, hospital beds, ventilators, nurses, personal protective equipment, etc., actually the majority of what determines whether a person will live their life in good or in ill health has nothing to do with anything that we do in the healthcare system. The majority of what determines whether or not a person will have a healthy life is dictated by what we call the social determinants of health, the most important of which is a person's income. So the level of poverty that a person is born into dictates not only their own longevity, the likelihood that they'll develop chronic diseases, the likelihood that they'll be able to rate their own health over time as good, the likelihood that they will end up with chronic illnesses that require them to take long-term medications. It will also determine the likelihood that their own children will have healthy lives. And so the health impacts of poverty are individual. They're also intergenerational, and they are also pervasive at the community level. So depending on which postal code you live in, which area of town you live in, and what the average income is in that neighborhood or that part of town, it determines your life expectancy. And so these are factors that are much more powerful than any medication that we have to offer in the healthcare system. And it's something that I think at times like this, when we're so focused on the need for our health systems to step up and perform at a time of global crisis, we sometimes forget, what it is that dictates, for example, the likelihood that the COVID-19 virus spreads across a shelter or even a nursing home facility. So much of what dictates the global spread of a virus in a pandemic situation like the one we find ourselves in is linked fundamentally to factors relating to economic and social structures. So it's hard to overstate actually the importance of the impact of income on health. And it's not just because income allows people to purchase things that lead to health, although that is true. It does allow, having a decent level of income allows people to purchase things like safe housing, nutritious food, prescription medications that they need to manage their chronic illnesses or whatnot. But there are other ways in which living, as Hugh says, free of the fear from want, is incredibly powerful in terms of people's ability to live up to their own personal and community level potential, all of which contributes to health.
That's very helpful, and I totally agree with that as well. I guess in an era of increased physical distancing and the loss of employment that's subsequent to that, how is a basic income one of the possible solutions to address economic and financial need?
And it's funny, those of us who are working in healthcare right now have been struggling around this physical distancing. We're spending a lot of time in the healthcare system right now advising people to go home and isolate themselves. Some people live, unfortunately, in very isolated circumstances at the best of times. But many people who we're seeing, for example, in our assessment center here at the hospital where I work, don't have a place to go to where they can self-isolate. You can't send somebody back to a shelter when they've got a fever and a cough to wait 48 hours for their COVID-19 swab result to come back. And you certainly can't send them to self-isolate for 14 days or more while they recover from COVID-19 in a room that has, 15 or 20 or more people living in it. And so I think we are beginning to see, and we are going to see the full brunt of the impact of poverty on our capacity to live these public health edicts that we're all living under. Whether someone's, couch surfing in a friend's place because they've lost their job, which makes it, difficult for them to get access to their own bathroom and their own stash of food, and never touch the same fridge door as anybody else, et cetera, et cetera. So there are going to be very practical, very granular ways in which the loss of income and the loss of independence that comes from that income is going to limit the ability of members of our community to do what we are trying to advise them to do to stop the spread of the pandemic, all of which matters and is important. And although We're all lucky and grateful to live in a place where if we end up super sick from this virus, at least we won't end up bankrupted from the medical bills involved. That doesn't mean that we are free from the impact of poverty on the impact of this pandemic in our community.
Yeah, I would agree with all those points said. Thank you so much for that, Danielle. I'm going to now move on to introductions for our voice of a scientist outside of the world of health, Professor Peter G. Martin. Professor Peter G. Martin is an officer of the Order of Canada. The formal citation for this award was for his innovative research on interstellar matter and for establishing 2 world-renowned institutes of astronomy and astrophysics. He's a professor of astrophysics at U of T, a specialist of galactic ecology, star formation, and dust evolution. Thank you for joining us. Professor Martin, as someone who studies stars and things outside of our Earth, what do you find intriguing and inspiring about basic income?
Well, thanks for welcoming me back to Earth. It's good to be here. I'm a real fan of this idea of basic income. We've talked about preparedness, and preparedness, maybe in the case of an earthquake, is the disaster is going to happen, you have to have response systems. This is about income and people falling into poverty. And there could be response systems like shelters, like food banks, for example. But in a way, those shouldn't really be necessary. We should be working towards getting rid of those responses to this disaster by just doing something almost a no-brainer, I think, having a basic income. Or, well, you could say we're falling, but the people would fall back on it, but they would be supported by it, they actually fall. So that's what we have to try to avoid. So this is about elimination of poverty and, of course, improving health, as has been discussed. And it's part of the spectrum of addressing the very skewed distribution of wealth. And that's really another curve that needs flattening. So thinking of it globally, I would tie this in with the UN Declaration of Human Rights. I would tie it into the millennial goals, etc. And then the final thing I'll say is enabling people to live up to their potential. It's really the essence of all of our initiatives about equity, diversity, inclusivity. Really, I mean, and the outcome of all of these will be a better outcome for all in society, not just for the people that might have fallen into this predicament, but everyone all around.
And you mentioned a really interesting point in your past discussion about meeting our human potential and reducing barriers to that, whether that's by promoting equity, diversity, and in this case, a healthy and stable income. How important do you think that is in this time of crisis, particularly when people are going to be disproportionately advantaged by it, and some groups may suffer more than others?
Well, we're really in the midst of it, as far as I can tell from my sheltered existence. And in retrospect, having had a basic income would have helped out a lot. So let's think about, well, getting through this pandemic. What are we going to do? I will show my impatience with pilot studies and so on, just by saying I think things can be studied to death, and death could be, part of the consequences. So, do you remember that wonderful story in Toad and Frog, or Frog and Toad, called The List? Toad makes himself a list, and it's a self-help thing. Everybody understands, gets it organized, but it blows away, and then he finds himself floundering. so on. So you can plan a lot, but sometimes it's not going to work all that well. And we can have sober, well-researched, evidence-based royal commissions. But what do we know about royal commissions? A big response to a royal commission is, oh, we've got a shelf for that. So I think we really need to get on with these things and take advantage of the broad support that I believe there is for it, and just do something. And what Hugh has described is really simple. It's non-bureaucratic. It doesn't burden down any system. So that seems like a good idea. You could ask, are there lessons from the pandemic? And I think there may be already. I mean, in Canada, we're seeing an amazing response of these programs being worked out and implemented in a matter of days. And I'm sure they're wringing their hands wondering whether it's the perfect program, but they know and understand that this will be way, way better than doing nothing. And let's get on with it, see how it works, and plug the gaps where we think it all out in advance. It could make it better, but get on to it. The basic income, compared to everything that they're doing now, should be really clear, understandable, and straightforward.
Right. Thank you so much for that, Peter. Now I'm just going to introduce all of our speakers to come up and talk a bit further about what advantages a basic income system has in the context of its application and delivery compared to existing forms of government aid. Maybe we can start off with you.
Who are you asking, Krish?
Hugh, I was asking you, maybe we could talk a bit further about the advantages of delivering a basic income system compared to an existing bureaucratic form of government aid.
Well, all the existing systems are not automatic. They require a application process. They require an ongoing regular proof that you're still poor. They require bureaucratic assessment. And they're different in different parts of the country with different sets of rules. The basic income would operate essentially off the tax system, which all Canadians pay into. It would be automatic, and it would not require that level of bureaucratic deliberation before someone can be deemed to be a recipient. They'd be a recipient not because they convinced a public servant they were worthy, but because their income fell beneath a certain level. That would make it more efficient. In our present circumstance, it would provide money quickly, all of which would be taxable in the hands of the tax filer, especially if they did it through the tax system, and it would be distributed in a much more efficient and effective fashion, and it would be something which did not treat people as clients but as citizens. And that is something which I think, particularly when you go through the kind of crisis we are going through now, where that sense of fairness and common engagement is really, really important to sustain.
And Danielle, how important would that sense of citizenship and fairness be in times like these?
I mean, it's critical, and I think the other thing that we know in terms of the complexity of our existing income support systems is how much time gets spent not just by people who are already stressed, standing in lines, filling out forms, discovering you filled out the wrong form, having to go get back and get the new form, having to figure out how to decipher the form, but also those of us who work in the health and social service sectors, spending our time trying to support that process. Hugh mentioned the Ontario Disability Support Program. I'm not suggesting that we would replace all disability supports with a basic income. There's still some, significant need for additional supports for people living with disabilities, but the amount of paperwork involved for clinicians, physicians, nurses, and others to help people get access to things that should be a right of citizenship is stunning, and so the knock-on effects of that bureaucracy across all of our other health and social systems are substantial. And it's one thing when that's affecting, a quarter or a fifth of the population. It's another when it's going to be affecting half or 60% of the population for a period of time as everyone suffers the economic hit that we're about to take as a result of this pandemic.
Right. And building on that, I think it'd be interesting to hear whether this pandemic presents an opportunity for us to redesign and redevelop those systems. Hugh, could you speak a bit further about what kinds of immediate steps could be taken to design those systems?
Well, I think in the present context, to be fair to the government, they have been, of Canada and the provinces, they've been scrambling to deal with this crisis, and they have been doing a lot of policy on the run. Their intentions and their engagement is very substantial and very positive. That being said, it's clear that we have structural problems in the way in which we deliver aid to folks who are in difficulty, which slows everything down, despite the best intentions of people who want to be helpful and constructive. So we will learn from that. And one of the things, just as when you're dealing with some public health challenge, moving quickly to sustain an effort that will in some way restrain the viral movement from one person to another makes perfect sense. It is also true that when the economy collapses, you have a duty to sustain people's ability to get what they need in terms of having the cash that's required. Poverty is not about a moral failing. Poverty is not about people who are lazy and don't want to work. Poverty is about simply not having enough cash for a whole bunch of different reasons. And the issue is, how does our society respond to that? And I think one of the things that will emerge from this process is Canadians will conclude we have to do a better job than we have been doing, and we have to be able to address this with greater clarity and precision than our present systems allow. Our present systems are based upon the moral failing of poverty. And I think that's a view that goes back to the 18th century and should be left back there, because it has nothing to do with good health outcomes, good education outcomes, social coherence, and economic opportunity, which after all is supposed to be at the very basis of our market economy.
There are a number of questions from the audience. Perhaps we can look at one of those and address those together. So a question from Tom Axworthy. Do we really need more testing for GAI? Given response to virus pandemic, why not learn lessons from that and just do it? Who would like to address this one?
It's Danielle. I'll begin by saying, I don't think we actually need any more research on this. I think, we've already got actually effectively a basic income guarantee in Canada for seniors. As Hugh mentioned, the old age security and guaranteed income supplement programs together effectively make a basic income guarantee for seniors. And we now, thanks to the Canada Child Benefit, have a pretty robust basic income guarantee for families with children in this country. We're now in a situation where the groups in between those is exactly the age group that's going to suffer the full brunt of the economic hit from the pandemic. And I would say now's the time to simply fill in the gaps. One of the things we're experiencing in the healthcare system right now, and I can't speak for the entirety of the country, but certainly we're seeing this in the literature as well as in our own local experiences, is that the focus that comes with a crisis is asking us to do things that we have all been talking about doing for decades. We've been wringing our hands saying, we need to move to virtual care and digitization of healthcare services. Overnight, this is happening all over the country, and we have figured out how to overcome barriers, both at the government level, moving aside policy barriers and regulatory barriers, loosening up where we need to loosen up, tightening up where we need to tighten up. Collaboration across institutions is happening, collaborations across professions, and all of a sudden, before you know it, stuff that, as Peter said, have been recommendations gathering dust on shelves for decades are suddenly being put full force into effect in, days. And so if we can do that in healthcare, I don't see why we can't do it in social policy. Why not just get it done?
Yeah, that urgency absolutely makes sense. maybe we can look at our next question. From Principal Nathalie Desrosiers, if we had basic income, it would be only through the tax system. Would it require for people to wait to get their money? Hugh, maybe you could address that one.
The answer is no. The people who now receive the guaranteed income supplement, seniors, have a deposit every month into their account, period, full stop. They don't have to keep on proving that they're still above 65, as they would if they were getting welfare. And so if we had this system in place, not only would there be a regular amount that was put into everybody's account to fill the gap between what they had from other sources and what they needed in terms of a reasonable standard of living within their community. But if the government decided in an emergency to put more money into people's bank accounts for good reason, it would not be a hard or arduous task, because the accounts are set up, the ability to make a deposit exists, and it requires reprogramming of the overall software. That's what would be required. We don't have that capacity now, as the government, despite its best efforts, is finding out.
Right. A question from Rennie. How does the program address disparity of costs of daily living, like rent in Toronto versus Prairie, Ontario, for example, or rural Ontario, or Paris? Oh my gosh, I should have read that earlier. Yeah.
Yeah. Well, if you take the federal government's new position that the market basket test, which is what it takes to buy the basics in any community, food, housing, clothing, heat, etc., should be the new definition of the poverty line. If you're beneath the market basket test, then you're living in poverty, and if you're at it or above, you're not. Well, that number is different in every province, and it's different in every jurisdiction.
We might have to wait a bit on hold.
The country in terms of the actual cost of living.
Mm-hmm. So a question from Ricardo. Hard times are the best times to give back. Why is basic income more efficient than just rising taxes to the rich and big corporations? And is that a dichotomy at all, really?
Well, I would argue that it's not necessarily a dichotomy. If you have a program, think about it, we have health insurance in Canada, and we all pay taxes to support that. If we brought in a basic income, the parliamentary budget officer has said that the gross cost of that would be about $43 billion a year before you count the federal and provincial programs, which are also cash transfers, which would be replaced by that. So the actual number comes down to about $20 billion, which is less than 10% of what the federal government now spends on an annual basis. So the notion that we could invest 10% of what we now spend to reduce poverty and all the pathologies, health and others, that poverty produces is a very solid investment. And the return on investment in terms of the healthcare system, in terms of educational outcomes, in terms of quality of life would be very, very substantial. So the answer to the question is we can do that, and there may be some modest changes in taxation, but we have to also look at the way in which healthcare and other costs would stop rising at the level they are, because we know, as Dr. Martin said earlier, as Danielle said earlier, people who are of low income get sick earlier and they go to hospital sooner and they stay in hospital longer, all of which cost us all sorts of money. So there would be savings on both sides. And if you think about health insurance, 1963 in Saskatchewan, everybody said, well, we can't afford it, and all the doctors are going to leave. And now it's one of those programs that is the envy of the world, because Canadians of all political affiliations had the courage to work together.
So we'll move on to the next question, but we got an idea that there's an interest to collaborate and work together. We have a question now from Margaret Biggs. Could we speak about how to move from the current web of FPT income security programs for EI, disability, Canada Child Benefit to a national basic income or a series of PT basic income measures? That would probably be best addressed by Hugh.
Well, look, as Margaret will know from her distinguished service in the federal public service and in the Privy Council office, we go through regular negotiations between the provinces and Ottawa and the territories on something called the Federal Provincial Fiscal Relations Act, which is how money moves back and forth, equalization, transfers that are made for healthcare and social insurance and all the rest. When that negotiation comes up, and that can happen anytime the premiers and the prime minister want to have that negotiation begin, we could have that discussion. How do you work together? We could do that very quickly, and you could change the provisions of the act to allow for the money to flow appropriately to deal with this new innovation. So it doesn't have to take many, many years.
Doesn't have to take that long to sort out. Yep.
And that's when you get the best possible results.
Right. Another question, I guess, looking at modeling from Lisa Hoffman. Can you point to any comprehensive financial modeling for a national universal basic income program in Canada? Would this be a federal initiative if best implemented, or provincial?
Well, historically in Canada, most of the social innovation has started at the provinces. Health insurance started at the provinces. $5 a day daycare, as it was then called, started in Quebec. The guaranteed annual income supplement for seniors started in Ontario. So often things can start in a province more quickly, but then there's a constructive contagion effect between what happens in that province across other federal government just takes it on. Now, the modeling that exists, of course, is the modeling that exists around the Gini coefficient. The Gini coefficient is a determinant that says this is the rate at which everybody falls beneath or above a certain income level, which is deemed to be appropriate, and what's the gap between the richest and the poorest. So that modeling tells us, as Thomas Piketty, one of the great economists of our era, has shown us, that when you have less inequality, when you have flows that are more reflective of people's equality of opportunity, you get better outcomes. You get better productivity. You get better economic performance. Those countries that have greater equality actually achieve better market share globally. So those models exist elsewhere, and they're available. And I think federal government officials have been studying them for a long time. And some of them, in finance especially, are opposed to this kind of reform because it removes their ability to give advice on how you design specific programs, when many of that kind of stuff is replaced by an automatic payout to people who live beneath the poverty line.
Right. So this is a question from Kashif Raza. If there was a dollar amount to be placed on basic income, what would that be? And perhaps we can solicit comments from our other guests as well. Would we start off with Peter?
I was out on another planet. Can you rephrase that for me, please?
No, not a problem. If you had to put a dollar amount to the amount that you wanted for universal basic income, what would that be?
I think it would be like you was describing. It would be related to what's needed to keep people and their families afloat in a particular context. You know, what their breadbasket is for their local community. So it would have to be tailored in some automatic way and defensible and transparent way, but that ought not to be difficult. What I was musing about on my other planet was that we've been talking about poverty and health, the health that one goes to the emergency room about, but we haven't talked about the mental health that goes along with poverty that doesn't show up in the emergency room, and the effect that has on society. So I think that we could discuss that. I think it'd be a really major benefit of a basic income, because people's whole lives would be relieved of a lot of mental strain, and that's how you get the most out of societies, to have people moving forward, not flailing around trying not to drown.
And perhaps, Danielle, could you comment on some of the psychiatric sort of research completed on low-income populations and how a basic income might help?
Well, in fact, we have direct evidence of this, which comes from the Mincome experiment in Manitoba in the 1970s, which Hugh referred to earlier. And Evelyn Forget, a former visiting fellow at Massey College, who crunched those numbers, found that all-cause visits to emergency departments, including for mental health, as well as all-cause visits to physicians, decreased substantially with the guaranteed annual income that was put in place in Manitoba during that period of time. And I like to say, the all-cause visits to the emergency department in Dauphin, Manitoba were reduced by 8.5% under Mincome. I'm not aware of any other intervention in all of the things that we do in healthcare that reduces all-cause visits to the emergency department by 8.5%. If we could find a pill that did that, we would put it in the water. So it's a pretty impressive statistic. And I think that Peter's right about the part of the reasons, for example, why poverty and ill health link together intergenerationally is because of the mental health impacts on not just individuals but their families and communities as a result of the stress of poverty. And so that's certainly it's a very real potential benefit. The other thing that we talk about sometimes is that not just the stress of poverty, but the stress of knowing that one lives at risk of being in poverty. So if you are in a situation, as so many Canadians are right now today, of knowing, well, I'm okay today and I'm okay this week, but if I don't get 6 shifts in the first 10 days of next month, I'm not going to make rent. That level of chronic stress and panic of living that close to the edge, which is the life of most people most of the time, even very high income earning people, in some instances are not that far away from, if they're living paycheck to paycheck from not being able to make their mortgage payments. Knowing that you won't lose your apartment, knowing that you won't lose your health insurance, knowing that you won't lose your ability to fill your kid's prescription for their asthma puffer, those very basic things, and being free of that level of stress has another component of mental health for the community, even if you never end up being the one who has to use it. And that is what was found during the Mincome experiment in Dauphin, Manitoba, that actually health of the entire community improved, even those people who never picked up a check. And that was in one of the theories, one of the hypotheses, was exactly what Peter just articulated, is that, just knowing that were you to fall on hard times, you would be okay, you wouldn't have to sell your farm, had a positive impact on your health.
And Hugh, I've only read a quick summary of your book, but you've had a set of anecdotes describing the importance of that. Could you speak further about what it means to have that sense of safety and how that ties into a feeling of dignity when you have those basic needs met? Who might lost you. Okay. We'll hold off on that. And maybe move on to the next question and wait for Hugh to get back. Okay, great. So speaking, I guess, further about that sense of psychological safety. Okay, Hugh, are you back with us? All right. Okay. We could speak further about what it means to have that sense of safety as well. Peter, you mentioned that impact on mental health is really important. Is that something you've seen in the students that you've been teaching at U of T as well?
Well, of course, we're not seeing the students right now.
Yes, not in person. Yeah.
But it affects everybody differently. But you can see that there's a huge strain, and the university is doing its best to anticipate that, be sympathetic about that, so that students who are already stressed in the best of times don't have added burdens.
Okay. And Hugh, you're back with us. Can we hear you all right? Could you say something?
Yes.
Great.
Well, look, I think the question was about students, and there was a reason that in the design of the pilot project, we said that it should include people between the ages of 18 and 64. And when people said, well, people between 18 and 25, they're students, whatever. And I said, that's right. We have food banks at the University of Toronto. Or we have food banks next to the campus of Queen's. And a lot of students, for a whole bunch of reasons, are in legitimate financial difficulty and under great stress. And the notion that they wouldn't be eligible for the top-up, in my view, makes no sense at all. And remember this. The average welfare recipient, a single mom living in Ontario, is now allowed to get about $675 a month. When the Prime Minister and the Minister of Finance decided what the basic amount would be for people who have to get an emergency transfer, they started at $2,000 a month. Mm-hmm. So that is a difference between $24,000 annually and about $7,680 annually. So that is a pretty
maybe Danielle, you speak further. Yeah.
Just to pick up on what Hugh was saying, because I think this question of what's the right amount, how much would a guaranteed annual income be, of course, depends on how one defines that essential basket. And there's been some really good work done at the Wellesley Institute around the notion of thriving income, and so. I guess this is, of course, a broader social conversation, but what is the right amount? What is that basket? We talk about the essential basket of services and we sort of gloss over that, but, does an essential basket include, how much does it take to live a healthy life? Yeah. Do we include your TTC pass or your public transit pass and assume that you're going to be, out and about and able to interact with other people? Do we include the price of a gym membership? Do we include, what do we assume you're eating and where do we assume you're shopping? And, do we assume that you're ever going to take your kids to the movies or whatever? And so what does it take to, I don't think anybody assumes that a top up for a guaranteed annual income would top people up to a level of wealth. But what is the right amount for people to live essentially a dignified existence without having to scramble or worry all month long? It should be an amount that gives people that freedom from fear, as Hugh says. And I think that that's a really important component of this. And certainly the amounts that we pay out on Ontario Works and its equivalents across the country, in no universe can a person live a healthy or dignified life on those support amounts. So that level of support is an insult to the people who have to spend their time standing in line and filling out forms to get it.
Absolutely. So I just wanted to take some time and thank everyone for their questions and comments. We've had a number of very interesting discussion points ranging from what a basic income is, what its value is both in times of peace, the pilot that it was completed in Ontario, as well as its possible application to the situation we're facing here right now in the COVID-19 pandemic. We've talked about the advantages of its delivery and application compared to existing systems of government aid. And we've had a wonderful conversation across disciplines, across astrophysics to medicine to a history career in public service. And there's been a lot to learn from this kind of dialogue today. I want to thank all the panelists for their time. Thank you so much, Peter, Danielle, and Hugh. And I also want to thank our audience for tuning in today as well. Thank you all.